Is a private room in a hospital better than a room shared with two or three other people? Yeah. Is universal healthcare going to be as luxurious as private healthcare? No. But also, healthcare has as many reviews and viewpoints as a restaurant. There are people who will tell me this is my favorite restaurant, this is the best pizza in all of the tri state area. Italians should come here for this pizza. It tastes like Velveeta vomited on a Ritz cracker and it offends everything in me. But the other person will tell you it's the best thing they've ever had. It has to do with your personal experience, your doctor, your care, your plan. If you're a relatively healthy 20-year-old who just goes in for a physical once a year, healthcare's fine. If you're somebody with a very unique condition and chronic pain, you probably hate healthcare in America or Canada. The sheer number of people in America with insurance who choose to go to Turkey so they can get a full body scan, because you cannot get that in the US without like a decade of begging. The thing that I don't stress in Canada is if I was employed in Canada and I lost my job, I wouldn't lose my insurance. I could have a heart attack and go to the hospital and receive care and not have to worry that that was going to cost me $100,000. In the United States, I lose my job. I don't have insurance. I have a heart attack. I would honestly consider whether or not to go to the hospital because it's going to cost me $100,000. Do I want to put that financial burden on myself and my family? That alone, same heart attack in two different countries, how you would view your options, that's just the mindset. Something like 20% of Americans just don't have insurance at all. If we cut Medicare and Medicaid, that number is going to double, if not triple. But even if you have health insurance in America, and even if it's private health insurance, it doesn't guarantee you treatment. Look at the sheer number of people on long COVID that are trying to convince their physicians to treat them for just not feminine hysteria. You're probably not as sick as you think you are. Or yes, we can confirm that you do have MS, but you don't have MS bad enough for us to actually give you the treatment plan for MS. So, like, go home and wait until you're sicker. The number of people in America who stay in shitty jobs and add to their stress, which deteriorates their health because they know they cannot leave their jobs because they will lose their insurance. Now, look, in fairness, Canadian healthcare does not cover undocumented or like certain citizenship statuses. So I think that leaves something like a million Canadians, well, a million people in Canada without healthcare. Canadian healthcare doesn't cover vision, dental, or prescription. Something like 90% of Canadians have some kind of a prescription plan. Not all. But just to know that if you get pregnant, you can have prenatal care. To know that if your pregnancy is detrimental to your health, you could terminate that pregnancy. Countrywide, through the entire country, to just not put that stress on women. It's not that Canadian healthcare is perfect. It's not that American healthcare is perfect. Nowhere is, and everybody's experience is different. I mean, yes, in America, you can certainly jump the line and go to, a private doctor out of pocket and get anything you want ASAP. There are private doctors in Canada. You could do the same. But, how many people can pay for that out of pocket? It's just, as a Canadian, you do not stress a physical. If you get sick, you go to the doctor. Might you wait? Yes. You don't have to wait until your cold turns into pneumonia and your pneumonia turns into some kind of sepsis, whatever. Like, you don't have to wait until it requires an emergency room treatment. Do Canadians wait to get into doctors? Yes. Do we have a doctor and a nurse shortage? Yes. Do we have the most cutting edge technology that is available in America? No. But there is a price for having everybody insured. Well, we want exactly what America has, but we don't want to have to pay for it and we don't ever have to want to wait. Well, no. Move to Turkey. Move to India. There are a growing number of seniors moving to India because they have these hospitals that basically specialize in seniors. You need a hip replacement, you need a cardiologist. There are like places popping up where it's like, yep, we're seniors. Those are great doctors. This is where we live now. And even they would probably complain. If you want some of the best healthcare in the world, Norway, Netherlands. Even the UK ranks pretty high, although there are a lot of people in the UK who will tell you how much it sucks. But ultimately, the stress of having it no matter what versus I have to have a job or I have to choose a job with insurance versus I have insurance. It might not be great, but this is just not a stress that lives in my life. There was a time when I had just started a job, but I had lost coverage with my other insurance, something or another, and I fell off a street corner. I completely screwed up my ankle, and like, I could have broken something. And my thought process was, like, I can't afford an American hospital right now. I think I was like 21 years old. I can't afford a hospital right now. It would be cheaper for me to source a pill on the streets to, like, get over the throbbing pain of a broken leg, take an Uber to the airport, take a plane from New York to Toronto, take another Uber from the airport to the nearest hospital, and get my leg fixed than it would be to go to the hospital that at that time was literally 2 city blocks away. Is I had healthcare coverage in Canada. I knew it would get fixed and it wouldn't even really cost me anything. Or, a couple $100 for a flight and a pill versus 2 blocks away is going to cost me at least $10,000 if that hospital takes people without insurance. The lack of stress people with socialized medicine have affects their health overall. The way Americans stress healthcare, even if they have it, it's just something that doesn't exist in other places. Not perfect, but to reduce the stress in your life by 10%,